Welcome, ladies. Thank you so much for joining us. And Alison, I want to start off with you, please. What is the ESP COP?
I know, don't you love the UNNR acronyms? So it is the Essential Services Package Community of Practice, which is a very long-winded way of saying that we are, over the next 2 days, as UNFPA, CARICOM Secretariat, with the support of the EU, bringing together experts from across the region in the areas of health, policing, justice, social services, humanitarian aid, and education, along with CARICOM Secretariat, OECS Commission, to carve out, and I hope endorse, a regional roadmap with these key institutions and the national gender mechanisms, which will establish standards and priorities in ensuring service provisions for survivors of gender-based violence. And we want to ensure that this is of the highest quality.
Thank you so much for that. And Mariana, looking at it regionally, what is the significance of a community of practice versus individual efforts?
Yes, so building on from what Alison was explaining now, this is the first time that the Caribbean has established a mechanism, a regional mechanism with all the 22 countries and territories in their English and Dutch speaking Caribbean, where we will sit together as key regional institutions and representatives of the national gender affairs bureaus in each one of the countries. We're going to sit together to discuss accessibility to services for GBV, gender-based violence survivors, and the way that we will standardize the services, how we can share lessons learned, good practices, and challenges among all the actors across the region, so that the countries do not feel isolated in the response to gender-based violence, which is feedback that we have gotten several times. Some countries feel a little bit isolated, some countries feel a bit left behind. We want to make sure that there is a standard way of offering services across the region. And this is the first sort of coordination mechanism that is being established across the region, which has components for development, which is the Spotlight Initiative, but also it has a humanitarian component, right? Keeping into account that the region is so prone to emergencies, to humanitarian emergencies.
And Maria, I want to bring you into the conversation now, asking the question, why essential services as a point or a focal point for engaging your target grouping? And I guess there's also a good opportunity to just kind of categorically state what that target grouping is again.
Okay, essential services are important because it provides a minimum standard by which all member states should administer different types of services to survivors of gender-based violence. And that's a target group, whether women, whether girls. And essential services, because let's say, for example, in health, you may say that, well, St. Lucia has a model, Belize has a model, Jamaica has a model, Barbados has a model. But when we look in the service, we need to see that all of them at least has a rape kit. So minimum standard of service that will be necessary for the administration when it comes to trying to help women and girls who are in situations of GBV. So there's, and in terms of, there will be different types of services, and in the different areas, there will be minimum areas that we must agree on. Like take, for example, when we look at coordination, and we want to think of all the countries offering these services, there must be some measure of respect, some measure of confidentiality. So different countries will build on or improve their services because one size doesn't fit all. So it depends on the needs of the particular member states. But the target grouping happens to be women and girls who are survivors of gender-based violence. And we shy away from calling them victims because women have been surviving GBV every day. they live really to fight another day.
And thank you for that. And with that in mind, though, in terms of having these, the nuances, understanding the nuances of the narratives, of the terminology, I want to get from each of you, and I think we'll continue with you, please, Anne-Marie. How does the essential services package community of practice, how does it relate to gender-based violence or violence against women and girls? And I get a brief answer from you, then Mariana, then Alison. Thank you.
Okay, the essential services package relates in that the package is provided for women and girls who are experiencing gender-based violence. So it's actually targeted for them. And it's not only gender-based violence in times of emergencies, but gender-based violence in times of disaster, or ordinarily, it's a standard that you would want to have in your member state should a woman be affected and she ends up at the police station, at the hospital, wherever. So it's a minimum standard whereby the services are being offered.
Yes, so how does the community of practice relate to gender-based violence? And it's what gender-based violence and the response to this type of violence is the essence, the whole essence of the community of practice. What we're trying to do is to follow the essential services package guidelines, which is essentially, as Anne-Marie was saying, a set of guidelines and minimum activities and services in terms of quality of the services that will be provided to gender-based violence survivors, right? This basically to respond to the incidents, to respond to the situations that they're going through, mainly focusing on not just social services, but also including health, justice and policing, and basically in terms of the coordination of the services as well, right? So we want to make sure that while we have these quality standards for these services, that they end up becoming a safe entry point for survivors to go and get help for their, whatever it is that they're looking for, that these are safe havens for them, that they are accountable to their needs and to specifically, each survivor needs particular things, and not all the cases are the same, right? Like everything is different. Every survivor lives the violence in a different way and in a unique way. So these services must be adapted to these needs that the survivor have. And this will accomplish having gender-based violence referral pathways, right? Which means that a survivor, when they come into any one of these services, that they will be able to access other services to support their cases, minimizing harm to them, which means having to go to different entry points, right? Having to retell their stories many times and be re-traumatized, right? Once we have a set of services that are essential for survivors and they work and they focus on the needs of the survivor, you also minimize the risk to survivors and you increase the possibilities of more survivors coming forward with their stories and getting the help that they need.
Because I think a big part of that can be silencing survivors, but that is something that I want to raise when we return from this break. A very interesting conversation. Stay with us, you don't want to miss the next half. And welcome back. We are going in depth on the UNFPA. We are speaking about the ESP COP, and we will get into that again. But we are speaking with Director of the UNFPA Sub-Regional Office for the Caribbean, Alison Drayton, Gender-Based Violence Regional Program Specialist, UNFPA, Mariana Santoyo, and Deputy Program Manager, Gender and Development, CARICOM Secretariat, Anne-Marie Williams. And we got a definition from Anne-Marie and Mariana. We now ask you, please, Alison, but I also want to put in the caveat, how is it or why is it important specifically to Trinidad and Tobago and a little wider to the Caribbean that we get something like this done?
Well, important to Trinidad and Tobago as a country and as part of the region because the incidences of gender-based violence and very alarmingly of feminicide are going up across the region. But in Guyana, Trinidad and Tobago and Jamaica, a pretty steep uptick. All of the governments and others working in the area have expressed a lot of concern at what we're seeing. The pandemic has only exacerbated what was already a worrying trend. So the support to the government across the many entry points that survivors would deal with in ensuring consistency in the discussion on what does quality service look like across, as Mariana has expressed, and I cannot emphasize this enough, dealing with this in a way that survivors do not have to tell their stories multiple times, thereby re-experiencing the trauma, is very important. You cannot have a healthy society if you do not deal with these things frontally and in a way that mitigates the harm and work together on diminishing the incidents.
I could take the Caribbean perspective from CARICOM.
Yes, thank you.
Okay, this is important for CARICOM because CARICOM, as you know, is the premier regional institution. It's a regional international organization, and it's steeped in functional cooperation. But part of our mandate is to really create a resilient, healthy community. And there's no denying that you could never create a healthy, resilient community if half your population is actually affected by gender-based violence and all the issues that come with it. Women, girls, their children. So it is important for CARICOM to really coordinate this after the launch, because with the access that we have to the member states, it's an opportunity to really oversee what they're doing and to really pull the pieces of the essential services package, community of practice together. So CARICOM has a real important role in the grand scheme of things to ensure that this is sustainable and that it is well functioning so that all the member states, not one or two, but all the member states can be on the same page at different levels, but at the same time bringing the ESP COP into fruition.
And I really like what I'm hearing from you ladies, and it is in lockstep with a lot of the conversations that are happening in terms of policy makers talking about ease of doing business, breaking down silos so that yes, you maintain a level of confidentiality, but at the same time, you don't have someone, okay, well, I need to carry all this information here. I need to carry all this information here. And when we had those conversations, that was not even talking about the triggering, kind of traumatizing nature of some of these experiences that the survivors have gone through and continue to live with on a daily basis. But with that in mind, though, Mariana, what is the UNFPA doing to address gender-based violence, violence against women and girls in the Caribbean?
Yes. Well, UNFPA, the United Nations Population Fund, is the lead UN agency around sexual and reproductive health and gender-based violence. So this is our mandate, right? We work towards ensuring that women and girls, particularly in those also who identify as LGBTQI, the minorities, refugees, migrants, people living with disabilities, and young people, access safe and comprehensive sexual and reproductive health services, but that they also are able to access services if they have survived or are at risk of gender-based violence. So in the Caribbean, we work both under the Spotlight Initiative, which is a global initiative by the European Union in partnership with the UN to end violence against women and girls in development settings. So we work with the regional Spotlight Initiative, which is the community of practice is one of the activities of this program. And we also work in emergencies, right? So we also work to respond after there's an emergency, for example, the pandemic or the refugee and migrant crisis arising from Venezuela towards some Caribbean countries, the volcano eruptions in St. Vincent last year, right? So we respond to emergencies as well. And we support government mainly. We are working with the gender heads of the gender affairs units, with CARICOM, with the OECS Commission. We work at the policy level to make sure that we can influence change in legislations, in policies, that we advocate for this sort of initiatives to support and better respond to gender-based violence, but with quality services, right? We're working with other UN agencies as well, who are also part of the Spotlight Initiative, together, coordinated, so that we can better respond, because it's always better to respond together than individually. So each one of us focuses on their mandate, and we all work together to achieve, or reduce gender-based violence, but at least make sure that we are able to respond to it safely, and do a little bit more of capacity building, and make sure that the service providers and those actors who are specializing in this sector of work, that they have the tools to respond to these emergencies, or to implement programs such as the Spotlight Initiative.
I want to know about lessons learned and the importance of being able to move forward. And I'll ask you, please, Alison, in terms of what's the significance of having this larger community of practice and saying, okay, well, these are the experiences of these individuals, these are the experience of these individuals, this is working here. We can bring that together so that the outcome that we want is achieved a little faster.
That is actually, Dike, that's a great question. And I think it speaks to the heart of why the Caribbean, when it functions as a region, really bats, well above its head. Many of our countries are small, and many of the responders working in the countries are working in very small teams, with the tendency to feel isolated, and obviously with limited and scarce resources. And so one of the lessons learned in bringing us together across the region is precisely what you've already alluded to, the exchange of ideas. In particular, and this is a very particular problem in the Caribbean, in small societies, how do you deal with the issue of confidentiality? How do you deal with the fact that many people do not feel free to leave their situations because they're operating in an environment where, from an economic perspective, their options are almost nil? If we can come at this as a region, we can exchange some of what has worked, in countries, but we can also, as a region, look together on how some of these pernicious issues can be addressed. And then, we talk of the isolation of the survivors, but for those practitioners dealing in this kind of area, there's also the isolation of the service provider in what can feel like a very overwhelming, very heartbreaking, constant thread of having to do the same thing and again. And so,
and speaking of that heartbreaking thread, Alison, what is heartbreaking is that we are out of time. Naturally, this is something that cannot continue, but and speak to fully in this time frame. But Alison Drayton, Mariana Santoyo, and Marie Williams, we want to thank you so much for the work that we're doing. And we will hopefully continue to have conversations looking at the development as it progresses. And on behalf of the entire TTT News team, I'm Dike Rostant. This has been In Depth with me. Thank you for joining us.